If you have PMDD and you're nervous about pregnancy, you're not alone. And it's important to understand how PMDD interacts with pregnancy and what to expect. So the good news is PMDD occurs during the luteal phase of the menstrual cycle. So as pregnancy halts the menstrual cycle, PMDD symptoms that we know of pre-pregnancy go dormant. Hormone sensitivity can persist, and you might still experience mood fluctuations and different symptoms, especially in the first trimester. But for most people, the severe PMDD symptoms do subside for most of the pregnancy. However, it's important to understand that just like the cause of PMDD varies from person to person and how the symptoms exhibit, that can happen during pregnancy too. So while some people have complete relief of PMDD symptoms, others still find that they have other symptoms that could be caused from the pregnancy in other ways. It's important to understand and be in tune with your perinatal mental health. Perinatal depression and postpartum depression are still things that can happen. These conditions are distinct from PMDD, but can affect women who are sensitive to hormone changes. Establishing a strong support system for during and after pregnancy is vital. And if you don't have outside support like family and friends, this is when I would try and find a therapist, have a good team of doctors, and really be in tune and start trying to develop ways to be in tune with your body and your brain. Joining support groups during this time could be really, really helpful, especially mom groups. Self-care and stress management is really important. This may include relaxation techniques or a healthy diet, getting adequate sleep, and getting the exercise that your body needs. It's really important during this time that we kind of keep things moving and don't get too stagnant, because when we get stagnant, our brains get stagnant, and that's never good, especially as a new mom or a pregnant mom. And also always talk to your doctor about how you're feeling, your past medical history, and your fears. So now for my personal experience. With my first, I had complete relief of PMDD symptoms. I realized my anxiety was really lifted. I didn't have any PMDD episodes that whole time. That was 7 years ago. I was not as in tune or educated about PMDD that I am, and it took us once the PMDD came back to be like, oh, that's why that didn't happen. So yeah, my second, I had perinatal depression the whole time. I remember through the first trimester waiting for this dense fog and just no motivation, everything. I waited for that to lift and it never did. I also was off my ADHD meds during this time, and I think that had a huge thing to do with that. I was a mom at this point. When I was first pregnant, I wasn't a mom yet, and now I was a mom without my medication. And I think that really, really added to my depression and just feeling like I could not figure anything out that whole time. After he was born, I did not know I had postpartum depression until I was probably over a year past having him and started to come out of a fog. And yeah, I just sometimes you have to give a full year to really just start to feel like yourself. I tell women 2 years until you really start to feel like yourself again. And I'm at that 2-year mark and starting to feel like myself again. So just remember, while PMDD can be challenging, many women with the condition go on to have healthy pregnancies and are able to manage their symptoms with the right support and care.